but the importance of chest compressions in cardiac arrest. Chest compressions is a term used when we apply hands to a patient when their heart has stopped. So unresponsive, not breathing, in cardiac arrest, no heartbeat. When somebody's choking, then we're using what are called chest thrusts. So chest thrusts are for choking. Chest compressions would be somebody in cardiac arrest. As of the latest updates for infants, children, and adults, it's going to be 30 compressions and 2 breaths. We just need to be aware of how we're compressing, how deep we're compressing, and the size of us compared to the patient we're trying to help. So with infants or with all choking, we basically want to be, hand placement want to be in line with the nipple line and about 1 finger below, because if we go any lower than 1 finger below, now we're down into this area here where it's called the xiphoid process. That's where the rib line traces up to the bottom of the sternum. So your ribs, they have the costal arch up here, sternum, where the rib cage, where the ribs meet the sternum, that's called the xiphoid process, that area. If you're compressing this far down, you can lacerate the liver of people. You can rupture the liver, cause pretty serious internal damage if you snap that off, or if you're compressing low or putting so much force directly on the organ. So that's why they say in line with the sternum, center of the chest, lower third, in line with the nipple line, maybe just a finger below. So if you're using a 2-finger technique, which HSI still teaches, Red Cross and American Heart have gotten rid of 2-finger chest compression that used to look like this for an infant. So the Red Cross and HSI have gotten away from that. What they're now using is the heel of the hand or 2-thumb circling technique. I've personally used the 2-thumb circling technique in real life. I've never used the heel of my hand on an infant under 1 year in age in cardiac arrest. To me, it just seemed like too much pressure from an adult. So I just stuck with either 2 fingers or 2-thumb circling technique on occasion. Yeah, 2 fingers on a really young infant. Anyways, so per the standards or per the guideline updates, you can use either 3 still, depending on who you're certified by. With an infant under the age of 1, if you're going to use the heel of the hand, you are going to be exerting, there's a potential for a lot more pressure to be exerted onto the infant with an adult heel of the hand. If you're going to use, so I'll demonstrate that, then we'll cover 2-thumb circling technique. So with the heel of the hand, they want you to use, like I said, the heel palmar portion of the hand here to apply pressure to an infant's chest so you can do compressions. Now in real life, in every video I teach, for the most part, always get to the ground. Right now for demonstration, we're going to stay up here on the table, but don't ever do this on a table. Get to the ground. Too much risk of the baby falling off the table. So with the heel of the hand, going back to the anatomy here, ribs come up to here. This is your xiphoid process. It's where the hard portion of the sternum transitions into the soft upper abdomen here. We want to place the heel of our hand just below the nipple line, so about right here. Then the heel of my hand would extend up here. So it's going to look something like this, okay? Where the bottom portion of the heel of my hand right here is going to be just above that xiphoid process here, so I don't cause any internal damage. So the heel of my hand should be in line with the nipples and just below about 1 finger, so about right here. You're using the one-hand technique for an infant. That is Red Cross and American Heart's new policy. No more 2-finger for cardiac arrest in an infant per American Heart and Red Cross. If you're going to use the 2-thumb circling technique, you're just compressing equally with those 2 thumbs as your hands are around the body. That's what I've used primarily. It seems just a little bit more controlled, does exert enough force. Red Cross and American Heart have gotten away from the 2-finger technique because they say it doesn't create enough intrathoracic pressure to circulate blood out and then drop back with just using 2 fingers on an infant. So with 2-thumb circling technique, per American Heart and Red Cross, same thing. My thumbs will be in line with the nipple line here and just below about a finger width or so. So we're not down on the abdomen. So you don't want to do that. On all the studies where they've studied cadavers of infants and children, there are liver rupture once you start to get down into the abdomen in this area. So 2-thumb circling in line with the nipples just below here. I'm going to have my hand around the side of the baby like this. And then with that baby on a firm, flat surface, now my thumbs are in position, hands are holding the side. I would be standing and we'd be on the ground. Now we're just compressing. It's of huge importance to remember that when you're compressing, right, we're pushing blood down and up to the head and down the body. When we press, so blood circulates down. When we let go, in theory, it's coming back. So compression, release, compression, release, flow of blood out and back, out and back. So it's very important with chest compressions to make sure that when you are releasing on the compression, that you bring your hand up not off of the infant, right? When we're doing the 2-thumb circling technique, I don't need to jump my hands off like this, my thumbs, right? Don't need to do this. But what you want to do is allow for chest recoil, proper chest recoil. So that means when I compress, I'm bringing my hand up, and essentially I could slide a credit card between the heel of my hand and the chest of the infant. So compress, bring it up just barely to where you can slide a credit card through there. Idea is now you're providing that positive, negative pressure or draw to bring the blood back. So make sure you're on the lower third of the sternum, 2 thumb, or the heel of the hand for an infant. With the possibility of breaking ribs, I have done CPR on young infants and older people. The only time I know I've ever broken ribs was with somebody over probably around the age of 80. The question that typically comes with that or follows with that is, would I still compress at the same rate and same depth with those chest compressions if I knew I fractured ribs on an infant or anybody else for that matter? 100%. So you're going to still compress if you fracture the sternum and or ribs. I've never seen ribs pop out or anything like that. But just make sure you're applying the proper technique. Keep applying it optimally. That's what's going to save them. So it should be 30 compressions, 2-thumb circling technique, or the hand. Bear with me, please. So with children, be anybody 1 year of age on up to about the onset of puberty. So 1 to onset of puberty or around 12 years of age will be our children. So this is probably definitely the size of like an older teen. So toddlers around 1 to 4 years of age are encompassed in the child age range for CPR and first aid per American Heart, Red Cross, and HSI. This is a pretty old child, pretty big child. So for the difference between your, say, 12-year-old, 13-year-old, and your 2-year-old, we're just going to change the amount of pressure we exert. Now, by the book, it should be about 2 inches in depth and compression. With the infants, it's about 1.5 inches. This is why I stress throughout the entire chokingfirstaidcourse.com. If you guys haven't, please subscribe to the channel. It helps move this information out to people who really need it. But at chokingfirstaidcourse.com, we detail this stuff in depth in our training videos and in the scenarios. So check out chokingfirstaidcourse.com. You're going to want to exert a little bit less pressure. It's also why I advocate for you taking a really, really good CPR first aid course from a qualified instructor. Hopefully they have some experience performing CPR. If not, just make sure that they at least have equipment that has feedback mechanisms in it. So they have a way to put batteries into the mannequins. And then when you compress, you can hear here, there's no click. But as you get down to that proper depth, you're going to hear a click. And then there should be some type of a light mechanism in the mannequins, adult, children, and infant mannequins to show that you're at the proper rate and the proper depth, which is going back to if you have a 2-year-old in cardiac arrest, your depth of compression is not going to be the same as a 12-year-old. Should be roughly around 12 or 2 inches. That's why it's important to get your hands on these mannequins and practice, because they do mimic around 2 inches in depth. The infant's about 1.5 inches, and the adults are greater. With children, so 1 to onset of puberty or about 12 years of age, same thing, in line with the nipple line here. About a finger below, you can kind of see the costal arch are mimicking right here, the ribs, how they come up right here. So those ribs come up to the center where the sternum is, and that's that xiphoid process area right here. With children over 1 up to onset of puberty, we're going to use one-hand technique. Now, as you're compressing on those smaller toddlers or 1, 2, 3, 4 years of age, be careful if you're an adult how much pressure you put on there. With children that are older, you're going to have to transition to that one-hand technique. And then as they get even bigger, you may need to transition into 2 hands or demoing or put compressions with the hand and holding your wrist like this. So with a child in cardiac arrest, you're going to identify, same thing, clear the shirt in line with the nipple line here. About a finger or so below the nipple line is where you'll place the heel of your hand. So same thing, one hand here, and I'm going to compress. Make sure when you're coming up on the recoil and the rebound that you're actually lifting your hand up enough to make sure that you're allowing for recoil, and basically you could slide a credit card through. So same thing as with an infant. Using those compressions, make sure the bottom of your heel of your hand is basically just below the nipple line like this here, in line with the center of the sternum, and then you're compressing. 30 compressions. If you can do it with one hand on the ground, so be it. If you need to implement your hand on top of your wrist, so be it. About 2 inches of depth on them. With an adult, it's going to be a 2-hand technique. So if this is a smaller adult, say 19, 18, 15 years of age, two hands together. I'm going to interlock my fingers and then put my hands in the same spot just above that xiphoid process and compress. You don't want to interrupt compressions for more than 10 seconds. Studies show that the amount of pressure that we've built up over those compressions best optimally is around 30 to 40% of normal circulation if this person was alive. So every time we delay compressions for more than 10 seconds, it really does drop that pressure that's been built up inside the system. So make sure you get good hand placement just in line with the nipple line and then just below it, in line with the center of the sternum. Then you're either using two thumb circling technique for an infant, one hand for an infant with children 1 to 12, one hand center of the chest. When they get older and into the adult range, two hands center of the chest. Take care.